सर
स्टार्ट कर सकते हैं?
सर थोड़ा वेट कर लेते हैं।
हाँ,
अभी YouTube पे ज्यादा व्यूवर्स अभी ज्वाइन नहीं हुए हैं, तो 2-3 मिनट वेट करके फिर स्टार्ट करते हैं।
ओके ओके,
ठीक है सर, ठीक है सर, ठीक है सर।
मैं देखा ऑलरेडी
सर थोड़ा वेट कर लेते हैं।
हाँ जी सर, नो प्रॉब्लम नो प्रॉब्लम।
YouTube पे ज्यादा व्यूवर्स अभी ज्वाइन।
सर आप मुझे व्हाट्सएप में YouTube का लिंक भेज सकते हो?
एक जगह से एग्जिट करना पड़ेगा। सर I'll come with you, sir.
Okay.
So you will leave by 5:30.
Leave by 5:30 from here. But we have a meeting.
No, we will read. Then if you can become a host, right? You can change your host.
So I'm taking as a host.
Okay.
हाँ?
सर
सर को मैंने कहा रोका।
हाँ, बोलने में साथ में जाऊंगा।
Show me the stream. How is it? Okay. Good evening, everyone. Uh, we are about to start the today's webinar on role of sports physiotherapist in water sports, that including rowing, canoeing, and kayaking. Today we have with us Dr. Sateesh Kumar. He is a physiotherapist and working in NCOE Sai LAP as a physiotherapist. So he will be uh, enriching us on this topic. We welcome you, sir. Please, you can start.
Good evening, sir. Thank you, sir. Good evening, everyone who are watching this video. And today's my topic is the role of sports physiotherapist in water sports, especially rowing, canoeing, and kayaking. So myself, Sateesh Kumar, and I completed my Bachelor of Physiotherapy, Dr. NTR University, Andhra Pradesh, and I completed my Master of Sports Physiotherapy, Lovely Professional University. So directly I will start today's class. So first of all, Sports Authority of India started in 25th January 1984. The carry forward the legacy of the New Delhi's Asian Game. Then after Ministry of Youth Affairs and Sports control this Sports Authority of India and funding and promoting the sports. And their main goal is Sports Authority of India. Before I started the what is water sports and what is the rowing, canoeing, what is the rehab, I like to start a little about the history and how government funding, what are the places sports physiotherapists have the vacancies and where have the opportunities to, after completing Master of Sports. So our Sports Authority of India main goal is the promoting the sports and achieving the sports excellency in the national and international level. So Sports Authority of India, shortcut we say the SAI, S-A-I. In this, there are so many things are there. Khelo India, one of the things which promoting the school level games, sports, and promoting the women's sports. There are so many 12 verticals are there. The promoting the ground level facility and education and sports event, quiz among the students related the sports. And next, target Olympic podium. The target Olympic podium is the top sports or the players who are going to the Olympics. Next is 2024 France. The player who are achieved very well in the world events. Those are all comes under the top sports, and the government provide every facility in this. Next is the National Center of Excellency, is the NCOE. The shortcut is NCOE. Next, in the NCOE, there are so many places are there. For example, LFP, where I am working, rowing, canoeing, kayaking, swimming, and swimming, especially for the who are coming for the new in the sports, they want to go to the boating games. So before starting the boating games, they started to learn the swimming. Then in India, there are so many places are there. Each places, those are all NCOE, comes under the regional areas. And those NCOE, each area specialized for these particular sports. So why I'm showing this slide is the reason is tomorrow you may be getting opportunity in the Sai NCOE as a sports physio. So you must know which center conducting what kind of sports disciplines. So you must have thorough knowledge regarding those sports before selecting the area of the job. Second thing, if it is your near area, you can go, you can learn those sports related physiotherapy management and what are the scientific approaches going on in that area, you can understand during your education period. So there are so many places are there. You can notice Rohtak, boxing, Patiala, athletics, cycling, fencing, same way Bangalore, athletics, hockey, judo. There are so many sports are there. Not only the sports which mostly involved in the Olympics, the indigenous sports also government of India encouraging. This slide importance is you must know what are the sports are there. Government of India, NCOE or Sports Authority of India promoting, in which you need have depth knowledge regarding the sports physiotherapy. Next, Delhi. So Delhi, especially there are so many 1, 2, 3, 4, 5 related is there more than, and athletics, cycling, gymnastic, pure swimming, hockey, field hockey especially, and shooting. So NCOE, the main importance of the NCOE is the creating the players towards the Olympic level and nurturing the players. So in that year, you can able to see the high performance coaches, the coaches with are very, very intellectual. They know how to work with the teamwork. In physiotherapy, we study in our bachelor, especially rehabilitation team. Here, the team is especially to athlete centric and coach driven. The team related to the high performance coaches, high quality equipment, nutritionist, and sports scientific support, and uniform performance assessment. The uniform performance assessment means in India, you are in Kerala, you are conducting one sports particular type of the assessment, some range of motion, some height, some weight, everything. Same way, some limb length measurement, grit measurement, particular formula, particular parameter, same parameters, entire India. If the water sports present in Kerala, if water sports present in the Orissa, both area they are performing, they are conducting the same types of the parameters. And sports scientific supporting staffs, the player getting the scientific knowledge relating the how to develop the muscle, the physiologist, how to the importance of the muscle, how to train scientifically, less effort can be more useful towards the training. Then after physiotherapist, after getting injury, type of the treatment, rehabilitation. Then after anthropometrist, what kind of height, weight, body parameters you have, that which sports you suitable more, which sport you will get more success chances is there. All the teamwork, everything, player discussion, discussion with the player, discussion with the coaches, discussion with among the scientific staffs, those are all are very important. So जनरली क्या होता है कि हम कोई भी गेम होता है तो हम फिजियोथेरेपी में ट्रीटमेंट देते हैं और बोलते हैं ठीक होगा नहीं होगा, लेकिन एक टीम वर्क की तरह होता है कि हाँ न्यूट्रिशन अपने वैल्यूज बोलते हैं, इस प्लेयर में ये माइनस है, फिर बायो मैकेनिक्स वाले बोलते हैं ये इनका माइनस पॉइंट्स है. द सेम वे the biochemical reports, after biochemical reports you will understand why the player is under fatigue, why the player getting repeatedly joints pain or muscle pain or cramps. Those are all data helpful to improve the patient recovery very fastly. So not only Government of India, Sports Authority of India promoting the Olympic level sports or international sports, it's also promoting the indigenous sports. For example, in Punjab, the martial arts, Ghatka is the very famous. So martial arts also promoting. Then after different area in Kerala, Kalaripattu, in Telangana, Kabaddi, in Jharkhand, archery. Those are all are the native sports. The players know very well since childhood. They are seeing in the society. They are very enthusiasm towards the learn from their seniors. Those are all sports, not only Olympic related sports or world related sports. Kho is the famous only in India. That sports also promoting Government of India, Sports Authority of India. In this slide, the importance is, so many opportunities are there, not only completing bachelor, masters, some hospital sector or clinical sector. You have some other opportunities. You need to search, okay, tops, Olympics podium, you want to join physio, so you need to search. So NCOE, you want to join as a physio, then you need to apply. So you need to search like that. In this slide, the most important is there are so many sub centers are there, like extension centers. Srinagar one is the extension center, and STC centers, small centers which are nurturing the young generation, and they are catching the players where the raw players. The coach's main goal is catch the raw players, train them, and give the scientific training and send into the Olympics. So age group is the important. In this slide, age group is the important. If you notice, at the age of 8 to at the age of 25 maximum is there. Okay, it's very little bit, but if you see the range 8 to 25 means the children's also there, middle age, young age also there, teenagers also there. You need to understand the The X-ray, when you see the X-ray, the bone X-ray related the children, the bone X-ray related to the after 20, how it look like, so how it is the bone formation, everything you need to understand. So when it is it a really fracture one, or it is a growth plate one? So you need to understand the psychology of the kid. The young is very fear to take the treatment. He can very enthusiastic. Sir, what is this machine? This is the tense. So how it is work, how it decreasing my pain, how to use the ice. So ice, as a physio, we know different types of the cryotherapy, compression method, ice massage method, then after ice spray method. So which method using very well, how it use, we need to educate. There is a monthly education program also there in the Sai and COE. Not only improve the sports player knowledge, it also help the easy to, as a sports player, to convey the patient or convey the player how much time rehab is needed. So you need to understand the puberty level age problem, the psychological problem, the college going age problem. You need to understand, you need to give the treatment accordingly. Next, now I will come to our water sports. So water sports in India, Alapi, now it is a NCOE, comes under water sports national excellency area. So Alapi, Kerala, you can see India map, left side Arabian Sea, yellow color Kerala, and Bay of Bengal, right side Orissa, Jagatpur, that also NCOE center, and Andaman Nicobar in the Bay of Bengal Islands, Andaman Nicobar also, Sai Center is there. Extension centers are there, Srinagar, Bhopal. Those are so many areas, other private areas also there. If you focus in Jalandhar, near your Jalandhar, Sultanpur Lodi, now the water bodies, everything clean, and participating the canoe, kayaking, rowing games. So those are the water sports. There are so many types of the water sports are there, but I am to the point focusing because I need to cover the rehab, I need to cover the history. So I am completing to the point. So in Olympic, next French Olympic, you can able to see there are 28 plus Olympic sports are there. In the second row, you can able to see the canoe. In the canoe, kayak, two sports are there, but it represent as the canoe sprint. And you can able to see 1, 2, 3, 4, 5, 6th line rowing one. So those two sports, Olympic related sports, I am discussing. So water sports, there are so many types are there. Rowing is there, canoe kayaking is there, sailing is there, diving is there, water polo is there, swimming is there, and artistic swimming, subdivision. So those are comes under the aquatic water related the sports. So I am not covering the all related. I am covering the to the point rowing, canoe kayaking. So what is the role of the sports physiotherapist? The sports physiotherapist has a vivid role. One is pre-participation physical evaluation. So before, when the after lockdown, when player came to the centers, we need to the assess what's their height, what's their weight, what's their fat, what is their muscle grit, how is their previous injury, how it is, any muscle decrease, any recent injury in home, any type of road traffic injury, or in game he got any injury. So pre-participation, before participating the training, before participating the matches, the pre-participation physiotherapy important in this. We check the MMT, we check the balance, lower limb balance, upper limb balance, Y balance. So there are the different types of the test and protocol. Those are all protocols all over India, all NCOE centers following the same protocol. Then after on-field injury. So this is water sports. The player go water body to train their daily morning and evening and afternoon. And sometime they train in the land also, some running, some cycling to maintain the fitness or maintain the cardio. Sometimes weather is not good, so they can train some other type of the games. When cyclone is there, so they may try some other type indoor table tennis or swimming or some indoor swimming or volleyball. So some other sports also they train. So some chances is there injuries. So generally water sports, ankle sprain very, very less. But sometimes there's Kerala people like volleyball, Andhra people like volleyball. So someone practicing volleyball that day as their extra games, as all sports they play some other game, not only their pure discipline related game, to maintain the and recruit the other muscles, stimulate the other muscles. So in that time, chances is there some other type of the injuries. So on field, some fellow going in the water, boat में जा रहा है, training कर रहा है, suddenly because of heat. Generally, when someone play cricket, football, only sun rays fall on the body. But here, not only that one, the water reflection heat also there, humidity also there. So that's why player get heat stroke, player get cramps, middle of the training. Sometimes water waves are more and it stuck the player and get the injury. So different types of the water injuries available. We can able to see not only related the cramps, heat stroke, sometimes stuck because of they are going in certain flow against the water and they are not getting that energy and getting the injury. Then after recruitment and weeding out the process. So when we take in NCOE some new player, the physio role is there. Is it the physically he's the fit? Is the cardiac level? Not only physician, not only other anthropometrist, physiotherapist role also. Is it the physically fit? Is the spine alignment is correct? Are both shoulder alignment, hip alignment, limb length discriminancy? Those are all is okay or not? Or any fault is there? We need to inform and we need to tell the weed out procedure also. The player can able to recover or not. The player injury is very serious. Recovery chances is very less. Some nerve type injury. Then player can participate as a para-Olympic also. Then injury assessment and rehab treatment. So this is for everyone know. Some player get injury, he come to the clinic or some rehab center. So day one onwards, the treatment start. So that is simple injury assessment as generally we do follow in the hospitals, colleges, everywhere. Then gym. So gym, mostly fitness trainer is the main role one, but our role, some muscle is weak and a player getting repeatedly injury or overuse injury or stamina less in that muscle, endurance less. So that time we request the player when doing the gym, we give those exercise instead of calling separately physiotherapy and taking his name. See, in the centers, player train early morning, then after afternoon, evening, whole week, complete month, complete year. So we need to give them rest also. So instead of giving exercise in your rehab center, you prefer, you check that timing period and you give the training during the gym, collaborate with the fitness trainer, explain scientifically what's going on in the player and work with as a team. Then after video analysis, when the player in the water or when the player playing the games, everything. So what are how they are playing, any postural problem is there while training, because patient generally tells, when I am rest, I don't have any pain. But when I go the game, I feel little bit pain, I feel discomfort. So anything they're doing wrong. I remember when I was in the cricket academy. So one fast bowler running as like a snake, as a fast bowler, not running a straight level, he running like a curved manner. So that leads his back pain. So repeatedly we gave 10 days, 20 days pain, physiotherapy, still not recover. We asked, I want video of the when you are going for training. So when he gave the video recordings, posterior view, anterior view, side view, then we understand is the running pattern is not good. So once we change the running pattern with the visual cues, automatically after 15-20 days, gradually his adapted body turn into the proper running. Automatically his pain decreases. So same way, the video analysis, the game on field, what happening, why he getting the problem, his running pattern is wrong, his shoe is wrong, what happened, what he doing wrong, we need to understand. Then after MMT, generally we do the manually, but in sports, that is, we need to quantify everything, one and each point, digital value. For this dynamometer is helpful. When you check with this one, we can get the exact reading. What's the right hand strength? What's the left hand strength? How much difference is there? How much he need to improve his gym related activities, resistant related activities, flexibility, mobility, everything, grit measurement, everything is important during the assessment. The physiotherapy role is very, very vast. I am very compressing because of the timing. Next, what are the points we need to give the importance when someone going for the rehab? The considerable point is sports specific biomechanics. Just now I told, if the player is wrongly training, so you need to make the video. Sometimes we scold them, sometimes we tell them, yes, this is the minus going on. Sometimes we make the record and the visual feedback. Yes, this is the wrong going on, this is the correct going on, so correct yourself, like that. हम प्लेयर को जब वो इसका वीडियो दिखाते हैं तब उसको समझ में आता है, हाँ जी ये मेरा गलती हो रही है। वरना जब हम डांटते हैं प्लेयर को, यार तुम गलत कर रहे हो, या अपना बॉडी सही करो, एक बार बोलोगे, दो बार बोलोगे, तीसरी बार जब उसका बॉडी थक जाता है तब वो सही नहीं करता है। तो इसीलिए हम उसका रिकॉर्ड करते हैं, पिन टू पिन, कौन सा मसल कर रहा है, कौन सा जॉइंट रॉन्ग कर रहा है। तो पूरा जो बायोमैकेनिक्स का एनालिसिस होता है एक पर्टिकुलर लैब में, एर्गोमीटर के ऊपर, पानी के ऊपर, सब कुछ हम उसको दिखाते हैं कि यहाँ पर आपका रॉन्ग हो रहा है। Okay, next is off season, next to pre-competition and competition season. Anything problem? Can I carry?
No, no problem,
Yes,
sir. You
please
can
carry
continue.
on.
Okay. So off season, you need to understand the rehab. We give proprioception exercise, plyometric exercise, plyometric, very explosive exercise, and that leads to injury the player. Suppose tomorrow or after 10 days, he have the matches, competition, India level, national level, international level, state level, and you are don't know when is the player competition, and you are maybe right, that player required plyometrics, but without knowing that knowledge, when is his competition, you gave the plyometric exercise, explosive exercise, complete muscle injury exercise, the player's performance decrease in the match, and player may get the severe DOMS. So that's why you need to understand complete schedule. When is off season? When is the competition? How much time you have to give the rehabilitation? The player match, which one is very important, because athletic game period is very less. You see the sub-junior level, junior level, senior level, Olympics, Summer Olympics, Winter Olympics. In Summer Olympics, Para Olympics, Normal Olympics. Next level is Youth Olympics. Okay, because of the COVID, that is shifted little later on. But Youth Olympics also, they're very less age people. So the player match is very near, and you give some techniques or some exercise, explosive one, more plyometrics related, or some proprioception, and suddenly player don't know that exercise. First time he did, and he slip in the wobble board or balance board, and it leads to severe injury, the player career loss. So that's the important. Another one is the nutrition point of view. You need to ask, you are giving the exercises, then after DOMS will come, you need to contact the player, you need to contact the nutrition related. Ma'am, today I gave the explosive exercise, I need recovery, DOMS will come, I need to decrease that lactate threshold. And what's the urine color? If too dark color means the body are losing lot of water, lot of electrolyte. If the urine is pale amber color, means everything okay, player taking enough water. Generally for a 6 glass of water, 7 glass of water enough. For sports player, they lose excessive water, excessive electrolyte, so their body required that type of refreshment. Then after, biomechanical values, biochemical values and radiological findings. Some player calcaneum spur is there, growth plate problem is there, and the body leaking lot of protein, body lack of vitamin D and calcium. So that time with the physician, we refer the medications, but we need to check as everyone's role, sports scientific staff role, player taking proper medications or not. Maria Sharapova, one of the great tennis player, she took magnesium supplement. That magnesium supplement banned that year. She not did very big mistake, but and the same way, Prithvi Shaw, cricket player, he took some simple cough syrup, ban 8 months. Okay, so every month there is a session going on, Sports Authority of India, related doping, everything. What is the legal one? What is the illegal one? Which year? Which one is the ban? Everything class going on. But still, as a physio, sometimes we give topical medication, diclofenac, topical, lignocaine gel, topical, povidone iodine, topical. We give so many topical also. So we need to inform physician, or we need to maintain the record. Yes, we are giving this one. So doping authority, when they come, they check, they see the all the everything. When coaches know what the person taking, what the not taking, then it's not a big issue. Otherwise, it comes under the big issues. Then athletic relation manager, they maintain the players data, which school they are going on, what is their marks, what is their psychological issue, subject is any fair, because all are 10th class, 12th class student. The career they need to form in sports, the career they need to form in education. So any kind of school, bullying going on something, or some senior junior doing anything in the first school level, colleges level. So the athletic manager know everything about the player, their fitness, their health, their nutrition value, biochemical value, complete data, their financial, everything data they record. So they also help. We can discuss with them as a team. He's one of the main role in the team. Then after psychological, the player getting proper sleep or not. If the player not getting proper sleep, then after prolonged training, the player not get proper recovery. And psychologically, sometimes they want to decrease their weight, sometimes they want to increase their weight, so they not take properly food. Sometimes they take the food but willingly vomiting, then it leads to some neurological problem, bulimia nervosa, anorexia nervosa, tension related things. Those are all sleep problem, all comes under the psychological related. The psychological doctors are there. We need to discuss with them. When your player is not recovering in a proper manner, an acute condition 4 5 days, then after subacute condition 1 week, then after those are all not going in proper way, you need to ask with the psychological help to recovery and give the best to the player. Then sports specific fitness level, there is the few difference between the physiotherapy rehabilitation and fitness people make the player 1 year protocol. What's today's program, what's the tomorrow's program, what is the 1 week program, what is the 1 month program, what is the sessions, how many repetition, everything they make. In that also, if some player getting injury, that time our role is there. And we both generally in my center, my fitness trainer and myself, we discuss, sit each other, discuss about the player. Yes, this player have this weakness, please fitness sir, focus this muscle. Then the player is injury, sir, the player is injury, I will not give the fitness training, please give the rehabilitation related training. So those are the importance of the teamwork. And this is the preparatory phase, competitive phase, transition phase, and the sessions, totally before competition, how many sessions of training, after competition, during competition, how much intensity of the training, the first day after lockdown, the player training, before lockdown player training, near the matches player training, everything is the scientifically divided. So you can able to see the off season, pre-season, in season. So one range of motion exercise, 2 to 6 sets, how much sets, how many repetition, how much rest period, and tempo. Tempo is very important. Tempo is someone lifting the dumbbell. In which speed he supposed to lift the dumbbell, in which speed he supposed to down the dumbbell. So डंबल जब उठा रहा है, कोई पैरा बैंड का एक्सरसाइज कर रहा है, कोई रेसिस्टेंट का एक्सरसाइज कर रहा है, तो कितना स्पीड से हाथ ऊपर करेगा, फ्लेक्शन करेगा, एक्सटेंशन करेगा, वो स्पीड भी इंपॉर्टेंट है. सो जनरली फिजियोथेरेपिस्ट इस पॉइंट पर थोड़ा बैक हो जाते हैं कि कहाँ पर स्पीड बढ़ाना है, कहाँ पर स्पीड कम करना है, कितना टेम्पो पर जाना है. कभी एसीएल इंजरी हुआ तो कौन सा टेम्पो पर जाना है, एसीएल इंजरी के अर्ली स्टेज पर कितना टेम्पो में जाना है, लेटर स्टेज ऑफ द रिहैब कितना टेम्पो पर जाना है, वहां पर थोड़ा मिस हो जाते हैं, वहां पर थोड़ा उनको फोकस करना चाहिए. So next is individual planning. Of course, every player is the special. Genetically, I remember my childhood in Kolkata. वहां पर एक खास ट्राइबल पीपल रहते थे मेरे घर के नजदीक. Those are very strong people. They are look special, curly hair, look special. Their endurance is very, very good. There is no one near when they go for the marathon, when you go for the sprint. So उस तरह के प्लेयर को आप अपने सेंटर में लेकर आ रहे हो, उसको ट्रेनिंग उस तरह दे रहे हो, तो वो बहुत ही अच्छे से अचीव करेगा. सो एंथ्रोपोमेट्री का रोल बहुत ही ज्यादा होता है. उसका हाइट कितना है, वेट कितना है. अगर कोई नया प्लेयर आ रहा है, वो रोइंग के लिए सूट होगा, कैनो के लिए सूट होगा, कयाकिंग के लिए सूट होगा. कभी कभी आप स्पोर्ट्स इंचार्ज बनते हो, ऐसे फिजियो हो. आप सोचोगे मैं फिजियो हूँ और मेरा रोल तो फिजियो का है, ट्रीटमेंट देना है. चोट लगने से पहले या चोट आने से पहले प्रिवेंशन वाला प्रीहैब देना है. इंजुरी बार बार ना हो उसके तरफ रिहैबिलिटेशन देना है, प्रीहैब बोलते हैं उसे. नॉट ओनली दैट, अगर आप एक स्पोर्ट्स साइंटिफिक स्टाफ के इंचार्ज हो, तो सभी को मिलकर जाना पड़ता है. आपको हर चीज में नॉलेज होना चाहिए. हाँ जी, एंथ्रोपोमी में क्या हो रहा है, न्यूट्रिशन में क्या हो रहा है. इवन आप जो स्पोर्ट्स फिजियो आप इंटरव्यू भी देने जाओगे, तो आपको हर चीज में सवाल पूछेंगे. बायो मैकेनिक्स में पूछेंगे, बायोकेमिकल में पूछेंगे, न्यूट्रिशन में पूछेंगे, शू मॉडिफिकेशन में पूछेंगे. यू मस्ट हैव थॉरो नॉलेज इन योर बैचलर, इन योर मास्टर्स. सो स्टेजेस ऑफ रिहैब. कोई भी प्लेयर इंजरी हो रहा है, उसका एक स्टेजेस होता है. जनरली जब प्लेयर इंजरी होता है तो अर्ली स्टेज होता है, जहां पर हम प्लेयर को इलेक्ट्रोथेरेपी देते हैं, एक्वाटिक थेरेपी देते हैं, उसका पेन कम करते हैं. वी गिव द रेंज ऑफ मोशन इंक्रीजिंग एक्सरसाइज, इंक्रीजिंग द फ्लेक्सिबिलिटी, डिक्रीज द ट्रिगर पॉइंट. नेक्स्ट इज इंटरमीडिएट स्टेज, wherever the focus is the proprioception exercises, mostly the joint sensation exercises. Next, advanced stages, the player go for the plyometrics. Then after return to sports, sports specific exercise, functional training. So those are the stages. Whenever player get injury, he will meet the physician, he can meet the physio, and he rule out the player is a very big problem, a small problem. As on-field assessment, single chart assessment is there. The player is under the red flag, yellow flag, green flag. अगर red flag है, danger है, तो हम immediately उसको hospital लेकर जाकर हमारे एक्सरे करवाते हैं. No, the player is not that much injury according to the game. आपको you must be as a physio very focused. वहां पर वीडियो डिस्प्ले होते हैं, मैच का रिकॉर्ड होता है, या आपको भी बहुत ही फोकसली रहना है कि कैसे हुआ इंजरी. आफ्टर सीइंग दैट, you need to understand it's a ACL injury, PCL injury, not related that the player is injured and you went for the ACL special test, PCL special test. हाँ जी, हमने डेविड जे मैगी में पढ़ लिया है, सारा स्पेशल टेस्ट करेंगे उसके बाद रूल आउट करेंगे. नहीं, ऐसा नहीं होता. You know, understand the timing is very less in sports like wrestling, kabaddi. Timing is very, very less. In football, cricket, you may get little time. The concussion time is there, the player replacement is there. In few games, the player replacement also not there in badminton. So you need to quickly assess, you need to quickly give the proper treatment, and you need to understand the player is under red flag, yellow flag, green flag. क्या है, उसको फिर से खिला सकते हैं few minutes में, या तुरंत ही बाहर लेकर जाना है. तो इस तरह होता है. And the player need medication, or player need some emergency based, some electrotherapy treatment, reduced, and some taping and eye spray. जो टीवी में ऐड होता है वो मेडिकल स्प्रे होता है. मेडिकेटेड स्प्रे के बारे में हम नहीं बोल रहे हैं. वी आर टॉकिंग अबाउट द आई स्प्रे. इमीडिएटली डिक्रीज द लोकल इन्फ्लेमेशन, स्वेलिंग, रेडनेस, एवरीथिंग. देन आफ्टर प्लेयर गेट द टेपिंग एंड गो अगेन द मैचेस. आफ्टर द मैच, रिहैबिलिटेशन प्रोसेस अकॉर्डिंग टू दिस इंजरी. सो नीचे से ऊपर जाएंगे, from 1 to 3 down to up. So whenever player get injury, electrotherapy treatment, aquatic therapy, therapeutic muscle rub, cryotherapy, cupping therapy, dry needling, range of improvement, range of motion, stretching, muscle energy technique, mulligan, dynamic tape, and KT tape. There are so many types are there. Generally, we prefer the KT tape, but suddenly when player under the water sports, they required some tape which adheres very perfectly even in the water touching. So that time we use the dynamic tape. And mulligan technique work very well, but you must have good hand skill. Then after electrotherapy treatment, it's under very vast tense. What kind of the tense? Sensory tense, motor tense. If you acute condition, what kind of tense parameters? try to learn yourself when you are in the students, as like a physician give the medication, diclofenac medication 2 times a day, after lunch, after meals, 1 week or 1 month. That type of parameters you need to write related the electrotherapy treatment, exercise therapy treatment. If you are thorough in that, then everyone appreciate your rehab. So electrotherapy treatment, how many times? What kind of electrotherapy? What's the next? In acute cryotherapy, what kind of cryotherapy? Ice spray or compression method or poppy skill method or ice massage method? Which method? Aquatic therapy, active assisted exercise, free exercise, or cycling, treadmill, underwater treadmill. What kind of free exercise? Non-weight bearing, partial weight bearing, complete weight bearing, complete depth knowledge of exercise therapy required. Then patient, if pain reduce and range of motion improve, then we go for the muscle endurance. Less weight, more repetition. Then after proprioception, low plyometric, small jumps, not a heavy bungee jumps or not a heavy that frog jumps, high jumps, small jumps, pain-free jumps. Proprioception, oval board, balance board, Bosu ball. Then after plyometric exercises. So which stage, how many weeks? It's depend upon your experience, depend upon the player, past strength, past stamina, and it's depend upon the player recovery, player diet, everything matters. So I can't say the first stage is comes under the 1 week or 2 week or 3 week, because it's completely depend upon patient to patient. Yes, after getting range of motion, good range of motion, we can go for the next. After getting the good proprioception, good balance on wobble board, rocking board, balance board, and balance disc, wobble board, trampoline, then we go for the next muscle bulk improvement. Muscle bulk improvement, more weight, less repetition. Then after sports specific functional training, some tennis player, we give the tennis bat and give the some TheraBand resistant, and he continuously repeatedly practicing. Same way cricket player, in hand we give the resistant band with cricket ball, he continuously do the bowling with the mild resistant. Same way in pedaling game, rowing, canoeing, kayaking, we give the resistant band and the player do the indoor pedaling. Then return to sports, we give the sports specific test. Then after player pass, we tell the player coaches, yes, player is pass. We maintain the all record, both hard copy and universal soft copies. So player, when the pass completely fit, is ready to the play. So today's topic is rowing related, the rehabilitation. I gave general idea. When we give the to the point, so many people know about the famous sports in India like cricket, football, field hockey. Those sports developing nowadays, India giving best performance. And one of the famous sports, rowing, Kerala, rowing very famous in ancient days onwards in Africa, Europe. That rowing is very, very famous to transfer one place to another place. And Olympic, the game is there with so many events. So in this game, when player pedal or oar, the player not go front side, the player go back side. Okay, the floating buoyancy markers are there on the water where they separate the one player to another player. It is the single rowing and the player going backside. You need to understand, player going backside, not front side. So this is the little difference. Generally sprint, when someone is running, he go front side. But in this sports, the player go backside. So what is this meaning? Player back muscle is very, very, very important. Complete posterior chain, posterior fascia, very, very important. So rowing mainly two types. One is the sweep rowing. Another one is the sculling. So I will show the pictures. This is the sculling, one oar in each hand, and another one is the sweep rowing. Generally, we call the rowing. So player holding the row with both hands. So you can able to see 8 players are there and one guider is there, Cox players. So in Olympic area, upcoming Olympics, France, those are the men, women event, single player, double player, cox less 4, and quadruple skull 8-player, men separate, women separate, lightweight, heavyweight. And just now I got the news, indoor rowing player get the 6th position in world championship just now. So same way, continuously matches going on, not only water indoor. So this is the best performance India Olympic in 2020 Tokyo, the 11th position lightweight. So when technical word also you need to understand. So when coaches discuss with you, yes, this player is the a lightweight player, skull rower, sweep rower, you need to understand what they are telling. You need, if you don't know the technical terms, you don't know that sports little depthly, you can't able to connect with the coach. Once you connect with the coaches, they will teach you, they will give you entire their life experience knowledge. High performance coaches, they have the plenty of the years knowledge, Asian games, international games, all the knowledge you want get freely. You must have good communication skill, good soft skill. So this is the main difference. Our Indian player, the both hand they are holding, and two players. You can able to see very long boat with big oars. And the another photo. If you notice one thing, one side the nature is the trees, water, boat houses. Another side, the nature is the Hyderabad related big apartments. So those things also player gets psychologically affect. When I discuss with the high performance coaches, they said, yes, that's matter a lot. We train in some particular area where very greenery is there, and we are going back and we feeling very pleasant. And suddenly when big apartments came in the matches, and we not feel that pleasant sensation, and suddenly we are not giving our the best. When second time they are attending the same area, they're giving some better performance. So when player attending the first time some new places, you need to motivate, you need to give the psychological counseling also. So those are the different stages of the rowing. This is the ergometer I am showing. The starting phase, catch phase, drive phase, finishing phase, recovery phase. So player may tell you, sir, during recovery phase, na, I am feeling pain. During catch phase, I am feeling pain. Normally, I don't have pain, but during the catch phase, I am feeling the pain. What's the reason, sir? During the driving stage, I am feeling the pain. So you need to understand every stage, particular muscles are working. So in that phase, that muscle is the weakness. So you need to focus particularly to the point those muscles, mostly posterior chain muscles, hamstring, calf muscle, glutes muscle, and gluteus medius, maximus. I will show you the next in this. There are latissimus dorsi, forearm extensors, quadriceps, gluteus maximus, and stabilizers muscle, mobility muscle, trapezius muscle, posterior deltoid. So every stage, particular type of the muscle. So you need to understand as a sports feature. Yes, the player is getting pain in particular stage means particularly every time you don't need some range of motion, some MMT, some special test, MRA, X-ray. No need to that much big test. You required ask properly which stage you are getting the pain. Some majority of the time player tell which stage the player get pain. So this is the ergometer. Recently, India won the first prize in the Asia ergometer 1 month back, and today world event 6th position in ergometer. So ergometer is the indoor one. We can connect with computer and Wi-Fi and every directly. The international body understand the COVID situation, and they are conducting nowadays indoor related. You may saw this machine in some gyms or somewhere. So common injuries. What are the common injuries in rowing, especially IT band syndrome? IT band syndrome. IT band is very iliotibial band, lateral side of the thigh, very tight, leads to the knee pain. So someone player says, sir, I have knee pain. Don't rush to treat the knee area. Assess the range of motion of the knee. Assess the any trigger points in the IT band. Assess the gluteus 3 muscle, gluteus maximus, gluteus medius, gluteus minimus, properly balanced or not. If any muscle strength or MMT is altered, then you give the strengthening according. Then ONE, if you not give proper in-time treatment, it turns into the ONE. Low back pain, because it is the sitting game, continuously compression of the L4, L5 disc level that leads to low back pain, disc problem. Then after strain in the lats muscle, because of when the competition sprint happened, when player gave his 100%, tear chances is there, muscle strain chances is there, skin rashes, because player continuously in the water touch the body, and glutes area, skin rashes, ulcer chances there, heat stroke, suddenly player collapse. Always physio and medical team comes along with the sports player in speedboat. If any injury happen, player faint, immediately boat go and give the first aid treatment, whatever the required electrolyte replacement or cryotherapy treatment, water therapy, whatever required we give. Cramps, any magnesium deficiency, depend upon, you need to check your what are the medications or what are the nutrition supplements is allowed, we can give accordingly. Some heat sprays also there, which relieve the cramps very quickly. Tennis elbow, very common, because extensors working very more continuously, repeatedly, 3 times a day, 1 and 2 hour, 3 hour training leads the repetitive injury. Next sports is the canoe sports. Canoe in India, it's a growing now. We achieving lot of medals in the Asia, but Olympic level, we need to struggle a lot. We need to develop. We need to nurture the player. Our player giving the best, but physio also need to give them good rehab. Then they fastly recovery and they give best perform in international level. The canoe sports we generally say, but canoe C represent canoe, K represent kayaking. Generally, we say in Olympic canoe sports, but in the canoe sports, if they are saying canoe C or canoe C sprint, means they are belong to canoe sports, or canoeing, or they represent K, capital K, then it means kayaking sports. Same way, slalom is another game is there, rafting related. It is a more adventurous game in the canoe kayak. Very injuries, very common. Some poles are there in the white water, very fast moving water. Generally, canoe kayaking is the stable water or silent water with less tides. But slalom is very fast water, white water. So this is the canoe where the, sorry, this is the canoe where the player kneeling in single leg. So in physiotherapy, exercise therapy, we study different positions, derived position. So in this, one of the derived position is one leg kneeling. In that position, 4 player, quadri-player training in international level. Sometime Olympic player allow single canoe, sometime 2 player, sometime 4 players. So different. In India, it's a flow player is allowed. And in this, important is handedness. Right hand canoe player means their right hand is the down and it's pulling the water, and left hand giving the direction. That is the importance. So you need to ask the player, sir, I have the shoulder pain. So which shoulder, right shoulder or left shoulder? Right shoulder. So right shoulder is the dominant hand, means pulling hand. Yes, sir, right shoulder is my pulling hand. I pull the water while I game, and another hand giving the direction. So pulling area required more resistant, and direction area less resistant related. So in Olympic, kayak single 1,000 meters, kayak single 500, kayak double 500, kayak 4 500, both women's, men's, canoeing single, all comes under the canoe in the big name, but canoe separate C means purely related, that single leg one leg kneeling one. Kayaking means sitting one. I will show the pictures. So this is the canoe related. The player middle of the game in the boat drinking the water. The medical team giving nutrition supplement, electrotherapy or water therapy. When they are completely dehydrated, we give the water. And if you notice here, they are using foam to rest their knee leg. Okay, the knee, which is the weight bearing, they are taking the foam. So you need to ask the player, the foam is your good one or you are using little older one, little damaged one. That also leads sometimes knee injury, knee bursitis, knee rubbingness, bursa inflammation. And what kind of shoe they are using. So player sometime during practice not use the shoe, but during the competition, waterproof shoes they are used, because slipper chance is there. If the player fall before the match, because those are all water body areas, chances is the fall. So if a fall before the match, so complete his 1 year program will damage. Another thing, biomechanical video one. So you can able to see the player, one is right-handed one is left-handed one. There is no such a rule like that, but the player want to balance the boat. So those are all water sports require lot of energy, balance, and a lot of endurance. So in this, the player want to balance. That's why they are going one fellow right hand, one fellow left hand, but both same hand also allowed. No, there's such kind of rules. So in this four, if you see the second player alignment is very, very good. The last player lean one side. That leads, if we not correct the player with the video analysis, with exercise therapy, the player in future chances is there getting postural scoliosis. Okay. So then after, player will tell, I have shoulder pain, and you may focus continuously on the shoulder treatment. But when you remove the dress, you can able to see the spinal curvature little changes, umbilical cord, the line of the body line is little change. So that's why postural assessment is the very, very important. I have one video here, but I think it is not playing. Okay, no problem. In this video, I will share later that video. In this video is related the how much energy required when they play, that related video. I request, can please lastly it play. And another one is canoe related injury. So you understand what is the rowing, how it is look like, how many types are there rowing. Okay. So player will tell, I am scull rower, I have this problem. I am sweep rower, I have this problem. Generally, I am a scull rower, but my competition is near. That's why I suddenly shift to some other rowing. So my performance is not good in the scull rowing. So I shifted to another sweep rowing. So that time also player gets some back issues, back pain. In canoe, some common injuries are shoulder knee overuse injuries, because one knee completely bent, another knee completely hip bending. So bursitis is common. Imbalance of the muscle strength. Deltoid, anterior deltoid, middle deltoid, posterior deltoid. Three deltoids are there. So posterior deltoid, if not equally strength as like an anterior middle deltoid, then definitely he get the shoulder pain. Same way, the knee surrounding muscle need to equally strength. Lack of flexibility, one hand up and down, he doing very good flexibility, touching very well. Same way, if it is vice versa, another hand down, another hand up, same flexibility required. Both dominant hand, non-dominant hand, he required good flexibility. Then shoulder injuries are very less. The mobility is the very, very important. Then after cramps, postural scoliosis, as we saw the photo, one side completely player lean and continuously training 1 hour, 2 hour, 1 week, 1 month leads the shoulder problem. The reason, because the biomechanics is there. If your spine also problem, your latissimus muscle problem, automatically the origin insertion leads to muscle joint problem. Then cramps as heat stroke, and rest no pain, but during game pain hurts. Means player tell, during rest I don't have pain, sir, but during my catch time I feel pain. When during my different position I am getting the pain. During my starting catching period, during my sprint, first 10 seconds I get the pain. Later I don't have the pain. Whenever I go, first 10 seconds I feel extremely pain. Then after I don't feel pain. So you need to rule out what kind of the pain. You need to ask specifically, is it the muscle endurance problem, or muscle strength problem, or proprioception problem, or flexibility problem? Assessment is very, very important. And generally, when players say during rest, I don't have pain, but during exercise, I have pain. So we give special type of the electrotherapy, wireless electrotherapy. We give directly to the shoulder area, knee area, and we ask the player, do whatever the movement you are doing. And during the exercise, the player getting electrotherapy treatment, tense treatment, the player Russian current treatment, the player decrease the pain and player feel muscle improve the strengthening. So some core exercise, some player have the back issue and he can't able to do the abdominal crunches. So we need to create some other kind of exercise to strengthen those muscles. Not only the traditional exercises, we need to understand, yes, the player suffering with that problem. So I need to give alternative exercise. So one day the climate is very worse. So pedal pools are there. In this direct camera is there. The recording everything, player performance, and player can able to see how much speed they are driving, and boat stable one place, boat not go, but the speed is recorded, how much speed the player going, and player not fall because the who hangs are there which hold the player in particular position, and resistant exercise with the TheraBand functional. This is the exact functional training. After canoeing, our next game is the kayaking, stand with the capital K alphabet. The kayaking is the sitting game, and both we say as the canoe sports, but they looks like a little different. The single player sitting and knee bending. So everyone thinking, oh, it's the sitting game, maybe shoulder is mostly involved. It's not like that. It's the rhythmic of the knee, shoulder, both leg rhythmic and knee, shoulder. I will show in the next slide. So what's the weight of the boat? What's the weight of the player? The weight also matter. How many players total? They are equally synchronized players or not. If the players equally not synchronize, not equally coordinate, then also the game is not go that much properly. The proper syncing is very, very important among the all the players. So you must know who is the international player, who is the national player, who is the Para-Olympic player recently participated and represent the India in canoe sports. What kind of boat it look like, so where is she from? So all the information you need to gather. One day in cricket, I discussed with my coaches related the sports, everything, and suddenly he not remembering the best world female cricket player, and he's struggling a lot when he's communicating with the everyone. And suddenly, as a physio, I recalled him, sir, she's that player, and she adverts her name. Like that, I told, then immediately told, thank you, man. And then after bonding between coach and me is increased, he understand, okay, this player, this physio understand the game, respect the game, and know all famous players. So when any Arjuni awardee or Olympian or Asian game medalist approach you, you need to greet. You don't know, hi sir, who are you? What's your name? You don't call like that. You need to know little homework. Who is the famous player and what is his achievement? If you communicate with him, then he, oh man, you remember my name. Thank you, man. Yes, thank you. So someone recognize your hard work. It's a very appreciate thing, and other fellow will teach you more thing, will give you more cooperation. This is the another video related kayaking. It's not playing now. How much effort required, where the training going on, what's the role of physio, how to motivate, all is there. Very small video, 20-20 second video. I request later play down. So this is the gym related equipment exercise. They proceed some gym assisted resisted. Gym means assisted resisted exercises. The assisted resisted exercises also we encourage sometime when the player is under rehabilitation program. So canoe, one leg bend, one leg straight, you can able to see. And as a physio also, you learn all those games. See, when I was very young, I know very well cricket, football, everything. But when you enter in particular sports physio, you must have thorough knowledge. You feel yourself. The coaches enjoy to teach the physios. Yes, you feel. First, if you feel what muscles, then you will understand what player telling, what player problem. If you don't know, you feel fear the water, you don't know the swimming, you don't know the water sports, then you can't able to understand player 100%ly. So ergometer is present in all sports, both in canoe, kayak, and rowing. Common injuries in kayaking mostly sitting game, as you saw the sitting and both hand movement. So low back pain problem, disc degeneration problem, shoulder over injuries because wrong biomechanics, trapezitis, back neck muscle problem, groin strains, groin stiffness, lack, because continuously our human body is not made up of for continuously sitting. If you see the human evolution, human body is made for the running, not for continuously sitting. Then OA knee, continuously knee, both knee bending, repeated movement leads the OA knee, knock knees later on. So giving training, you can able to see that down picture, the player getting training in water, indoor climate, outside not good, then they train indoor, and at the same time they taking some biomechanical analysis, biomechanics analysis, same time they are taking some electrotherapy, wireless electrotherapy treatment, another one for the proprioception, for the balance, and he want to feel what kind of water moving when waves are moving, and body need, core need to balance, the very good strength of the core required. Core, your abdominal muscles, back muscles, quadriceps, lumborum muscle, glutes muscle, everything needs to very good strength. So this is the video analysis. Range of motion as a physio. So this is the entry point in kayaking. The upper hand always eye level and always very smooth in touch, and down hand always a strong hand. Okay, and make particular degrees. So if you first you need to know what kind of pedal you're supposed to select, what's the height of the pedal, how to select one player's pedal, which pedal is the short one, which pedal is the wrong one, the blade, everything you need to check. Then proper holding. Then after upper hand, always relax. So one side during catching period, right hand is the up hand. During other side catching period, left hand is the upper hand. So always upper hand in the eye level, and maintain the particular degree during the entry catch period. The entry catch period always smooth. Then after pull the water, then you can move the forward and exit phase. So in biomechanics textbook, Cynthia Norkin textbook, you have different stages and of the throwing, ball throwing, different stage, early stage, wind up stage, throwing stage. Same way, every sport have the catching, entry point, exit point, different phases. Okay, which is correct, which is wrong. When you going with the medical team in speedboat and analyzing the video, you need to take the video in the side view, back view, front view. Then you can understand where player doing the wrong, what kind of hip movements are there, is it the upper hand proper is eye level, or little down, or little more. Why the player getting the shoulder pain? I told kayak players suffer more with the shoulder pain. So why kayak player more suffer with the back pain? Why? The proper rotation is properly going on, height is properly adjusted or not, everything is important. The hip rotation 1.09% is very mild hip rotation, rhythmic rotation also required. Then after knee bend, okay, 2 to 9.60 centimeter height, what's the speed going on, leg drive during knee flexion, how many degrees of the range of motion. There are softwares are there, mobile apps also there, where you can upload the video, and the video tells, and the software tells how much knee range of motion happened. Elbow 151 degrees bending, knee 126.3 degrees bending. The proper range of motion, ideal range of motion is there or not. So everything is the important. This is the ergometer, how it looks like for the sports. During the younger player, when he learning the swimming, before he do the indoor, then after when he learn completely swimming, slowly we send the player in the water. So this is the player, young player, learning swimming, learning dealing with the boat. So that time injuries are different. She also have the protective equipment, not sink inside the water. Even she know little less swimming. So that time abrasions chances are there. Injuries handling the boat, because boat is, you saw the boat weight is there, some 12 kgs, 14 kgs. Boat weight is there. The player need to handle that boat, weight of the boat, need to shift from floating jetty to ground level. So that time injuries are chances is there. So all time player need to carry the boat. Imagine you are the middle of the river and suddenly you fall and you need to go up to the end of the some river bank, some right side or left side. Then you can able to come out of the water body. This is the floating jetty. 1 minute. This is the floating jetty where the player give the little correction, range of motion problem, flexibility problem, catching period problem. Any position is wrong, we need to correct. We need to give the shadow training. Then after we send the player inside the water. So this is the floating one which float above the water. That time we need to understand younger player when shift from floating jetty to water, chances is their fall, chances is unable to handle the boat. Sometimes boat slip and it's go towards the water flow. So player starting days, at least 1 or 2 months, very fearful. So you need to understand, you need to help. Sometimes player unable to swim or completely faint, completely in the shock. You need to immediately go and save the player. So as a physio, I request in water sports, learn swimming, understand the canoe, kayaking, rowing, and help the players towards the reach the Olympic, whatever the country you are representing. So sometimes relaxation is important. We give the relaxation with the therapeutic massage. The massage team is there, and therapeutic muscle rub. Difference between massage therapist and physiotherapy massage is, the difference main point is we give particular area muscle massage, that is called therapeutic muscle rub with medicated spray or oil or ointment or gel. But massage therapist give complete body. So you need to understand what's your role, what's the massage therapist role, what's the fitness trainer role. So everything, if you know your role, you can't interfere the others. And the nature of recovery, natural recovery. Suppose Kerala is very hot, humid area in majority of the time. Winter season is very, very less, maybe 1 week or 5 days like that. So here, nature of recovery, the player required cold water bath, ice water bath. After game, player want ice water bath or swimming. Then player automatically recovered. In some areas, suppose Punjab, Himachal Pradesh, Srinagar, it's the extension center of the Sai. In that area, someone going the training and getting the injury, and after exercise, recover required hot water bath, steam bath, sauna bath, IRR treatment like that. So nature of recovery, which area you are working, that area, which is the best recovery method after exercises, that you need to understand. After gym, after sports, body continuously struggling, continuously releasing free radical. So body required some good nutrition, good recovery. So this is all about my class. So I hope you people understand the three different sports, and you people understand what are the Olympic level. And in India, how government of India promoting from rural area to uh, Olympic level, and how they spending the different areas, and what's their age, and where is our physio chances is there to get the grab the job opportunities. Not only traditional hospitals, ICU and clinic and teaching, there are so many other area, military area, Indo-Tibetan, Punjab armed police area. There are so many areas are there where required sports physio services. And every area is special. In starting, I saw some places where the every game, every area is the special. So during your studies, when you are doing BPT or masters, very depth about all the sports, very depth about all the biomechanics of the sports, then you can able to give the good treatment. There is lot to know. This is very glimpse of the class, not the depth class. I can take 1 hour completely on rowing, completely on canoeing. So this is very short. I hope you people understand the class. Thank you very much, LP University, and Chancellor Madam, Mani sir, everyone. Thank you, sir.
Thank you, sir, for your wonderful presentation on the topic. Now, I would like to request Dr. Suresh Mani, sir, to give a vote of thanks.
Okay, I hope it's audible to everyone. Thank you, Dr. Sateesh,
Thank you, sir. Thank
for being accepting our invitation, being here to deliver, very, very important aspect of, water sports. And also you have given an overview of the, the sports physiotherapy in India, the opportunities, especially in government sectors and private sectors. I think I just, want, extend our, warmest thank you for you be
you.
here.
Always my responsibility, sir, as a alumni of the LPU student, as
Yeah.
a expert, my role.
Yeah, I think we are so happy, you also be an alumni for the Lovely, and also as one of the important faculty before. Now you are there, another important mission in the SAI as a sports physiotherapist. I think
Thank you.
once again, thank you, and also for the LPU concern. LPU, as we know, we already have contribution in sport is enormous.
Yes, yes, always, sir.
Yeah, so we have 12 out of 13 LPU students, they won a medal in our the recent Olympics in
Yes, very proud moment, sir. Very proud
yes,
moment.
very proud moments for everyone, alumni as well. So especially your golden boy, we got Neeraj Chopra is one of the students from our institute.
Yes, sir.
One more thing I just would like to state all the viewers who are here. I think this series of webinar is part of the Erasmus funded project, where we have total 10 institutes across India, Sri Lanka, and Indonesia, as well as the 3 European institutes together. So basically, this is going to develop certain capacity building. As we said, what are the skills and knowledge that we should have, especially in treating patients with the sports injuries and those physical education aspect.
Okay.
In 3 countries, in Asian countries, yeah. So, and also how the sports is going to prevent or manage the non-communicable disorder. If you see all the Indonesia, Sri Lanka, and India, we have a
Yes, sir.
problem. The huge burden is the non-communicable disorders, diabetes, ischemic heart diseases. So how the
Yes, sir.
sports can create an impact in managing as well as preventing. So that is about this project. I think the next 2 more webinars is to come next week and another week following weeks. So this was a wonderful beginning. I once again thank you, Dr. Sateesh, for being with us in your busy schedule of you've been treating patients on field.
Always, sir.
Yeah, thank you.
One
Thank you.
thing to add, sir, for as a sports physio, we need to learn first aid also very well. We are very lucky when we are in BPT students in Dr. NTR University. We have the first aid syllabus. So first aid role is very, very important as a physio. Whenever someone getting injuries or abrasions or cut injuries or and whatever may be first aid required, CPR. So that also need to develop in the colleges level curriculum.
Okay, thank you. Thank you. I think we do have, integrated the first aid components in our scheme as well. It's there already.
Okay, okay.
Thank you, Sateesh. And also I would like to thank, my team, Amber, Anand, and Vivek, and other, colleagues of physiotherapy, and also the colleagues which are there, from other universities. They also supported, make this even, most rememberable as well as the successful. Thank you once again. I'll see you next week again the same time, 5
Thank
p.m.
you.
on Saturday. Thank you, Sateesh. Thank you for
Okay.
everything. Thank you.
The feedback form will be shared to all the participants on their mail. Kindly fill the feedback form by 9 p.m. today.